Obstructive sleep apnea is a common diagnosis in the United States. It affects up to 18 million Americans and affects 1 in every 15 adults. Obstructive sleep apnea is a diagnosis that some of us might just consider as consistent with snoring, but it isn't. It occurs when there's active obstruction of the airway when individuals are sleeping. The long-term health implications that are the silent implications that occur over decades, that being cardiac, pulmonary, and vascular issues, the risk of stroke is significant with untreated obstructive sleep apnea. And these issues, I think, at times are ones that we don't see because they don't happen immediately. We notice the snoring, we notice the issues that happen day in, day out, but obstructive sleep apnea can have a profound short-term and long-term effect on an individual's quality of life. If someone's unwilling or intolerant to using CPAP, they essentially have moderate to severe sleep apnea with no treatment. And that's a problem. This type of presentation that we'd see that might set someone up for sleep apnea or snoring will then be addressed in individual pulses. So it really offers us a treatment where there was no significant viable treatment option. It's entirely possible that we can take these individuals and bring them from having moderate to severe sleep apnea down to a level in their apnea-hypopnea index such that they are near normal, which is very exciting. Individuals that have had successful placement and treatment with this device have had significant benefits as far as their long-term ability to tolerate their sleep apnea and essentially resolution. Once individuals are initially screened and they have a drug-induced sleep endoscopy performed and they're considered appropriate candidates, individuals will be counseled by our sleep medicine experts about what to expect and whether or not they want to move forward. Insurance approval will be obtained, and then individuals will be scheduled for surgery. The procedure in and of itself is an outpatient procedure, and it takes somewhere between 90 minutes to 2.5 hours to place the device. It will require 3 small incisions, one lower on the chest for the actual sensing electrode, another incision for the pacemaker-like device just below the clavicle on the right side, and then a smaller incision on the neck for placing the sensoring electrode. These small incisions will allow the individual to go home the same day. Patients will return to the ear, nose, and throat clinic for a follow-up visit in 1 to 2 weeks. They don't have the device turned on for a month. Individuals are able to immediately return to work. They should be able to assume activities with some limitations to their shoulder movement during that period of time. In 1 month, individuals will return and see our colleagues in the sleep medicine department. And the sleep medicine individuals will then work to turn on the device and titrate initially what settings individuals will start with. They'll follow up with the sleep medicine team, and the sleep medicine team will then additionally titrate the device to get individuals the best result possible for their obstructive sleep apnea. We submit the strongest application possible for individuals. That may take weeks and it may take months. But our goal is to work with your team to make sure that you have a successful application for the placement of the device. And if you wish to move forward, that we'll be the team that will help you through that process. We're proud to be the first center in Massachusetts to offer this as a treatment option for individuals that have sleep apnea that's not adequately treated with CPAP. We sincerely want to offer you the best chance for success. I think that the collaborative team we've assembled at Tufts Medical Center can best provide you the service that you need to address your sleep issues. If you're a qualified candidate, we'll provide you the support from the beginning to the end of the process and get you through so that the quality of life you seek, your ability to get a good night's sleep, is what we've attained. We care about you, we care about your quality of sleep, we care about your quality of life, and we look forward to getting you through to where you want to be.